Hello, my name is Brittany. I've been a nurse for almost 2 years now. Currently work on a progressive unit at Baptist downtown.
I'm Josh, and I also work for Baptist. Just didn't bring my fancy blue scrubs. I'm wearing my gray this time. And I work Baptist South in the progressive care unit.
And I'm Jenny Redding, and I work at Borland Groover as a GI nurse, and out of St. Vincent is where we're based.
Awesome.
And we're going to present a gastroenterology nurse practitioner.
Alrighty, so some may wonder, why is gastroenterology even important? Well, as a matter of fact, yearly 60 to 70 million people go to the hospital just for digestive problems. And did you know that 21.7 million people seek health care and go to outpatient and inpatient clinics just for digestive problems? Sadly, over 245,000 people die yearly here in the U.S. just because of primarily digestive-related issues. What are the requirements to be a nurse practitioner in the gastroenterology field? Well, here in the state of Florida, you have to be registered as a registered nurse. Also, you have to be accepted into a program. We have listed on our slide that you have to submit supporting documentation that demonstrates that you're in compliance with the board. Each field has regulations and the amount of studies that you have to do for that particular field. Also, you have to submit proof of National Advanced Practice Certification, and you have to carry your own malpractice insurance. Thank you.
All right, and I'll be talking about some responsibilities of the gastroenterology Arnp. Okay, so some of the responsibilities that they have is diagnosing patients with their problems, treating them, a little health promotion, disease prevention, and ordering of the diagnostic tests. Now, for the diagnosis, this is going to be diagnosing diseases that are basically from the mouth, basically to the rectum, all the way through. A lot of the problems that you would see is GI bleeds, ileuses, and that kind of thing, ulcers that are going to be the main problems, cancers as well. So to treat, they use just basically they're able to prescribe medications to treat these illnesses or surgical cases. And actually, I saw that they're getting more nurses into doing endoscopies and colonoscopies in these areas as opposed to the doctors. Health promotion is always important, kind of a preventative maintenance, if you think of it like that, so they can make sure that patients are maintaining themselves and their health, so they're not coming in to be treated or be diagnosed with the problems. So, and that's goes along with disease prevention, and ordering diagnostic tests are going to be like ordering like an H&H, hematocrit and hemoglobin to check on that GI bleed, or you're going to order potassium, to check if they're with their nausea and vomiting. That's very important. Along with those are the fecal occult blood of the stool, those kind of tests, with also chest x-ray or abdominal x-rays and CTs. These are all very important diagnostic tests. Most common, I think, and most invasive would be the colonoscopies and the endoscopies. All right, and a lot of the same here with the standards of care. You have the assessment of health status, and that's just going to be basically a full systems assessment of the patient. Mostly in the GI case, they're going to be looking at the GI problems. And looks like we already went over diagnosis. A lot of this is kind of doubling up here, but one of the big plans is to develop a plan of treatment, which is very important to help the patient stay on top of their recovery through this process, because you don't want people coming back being readmitted with the same problems. So implementation of the plan is also very important, because this is going to be when you're educating the patients and ensuring that they know what they need to do, and if they have any symptoms, they can recognize them before they get too far along and give you a call as the ARNP. And follow-up and evaluation, of course, is very important as well. They've got to come back and follow up with you as the ARNP and ensure that the problems are not progressing and you're maintaining, and compliance, of course, is the most important thing here. Professional organization here, we have the Society of Gastroenterology Nurses and Associates. This is a society that kind of is just a good place to go to find resources for the GI community, not just nurses, but everybody involved. They have just meetings and discussions that focus on the GI community, along with like different things like scholarship opportunities and that kind of thing. It's really like a well-rounded society for the GI community here. And something we always all know about here is the nursing shortage, specifically in Florida, since we are the oldest state in the nation with as many baby boomers coming in here. So, you know, like I said, across the board, there's a nursing shortage. It's not specifically GI, but of course GI falls into that category. So when I talk about nursing shortage, it's going to be across the board. So across the board, we have 17% of residents over the age of 65 are going to be our patients, and that's a lot. So here in Florida, you see that more often than other states, because a lot of people like to come here and retire, so they're aging here. We're keeping people alive longer, and that's why that number is rising here. We have 17% of residents over the age of, nursing vacancies has increased more than 30% since 2013. That means that we don't have as many nurses to fill these holes, and we have all these baby boomers coming in here, but we have lots of nurses, lots of old nurses that are moving out. So that's where we're going to have this big tsunami of patients versus nurses, because you got to fill that blank, and that's why we are looking out of the country to find other nurses. A lot of nurses, a lot of my friends, specifically from the Philippines, getting brought in because they really need nurses here. We have an 18% turnover rate in hospitals. I think it's a hard environment in hospitals, so I think there's a lot of turnover rate, lots of staffing problems and whatnot, so I think that's why we have that turnover rate here. So we have 9,947 nursing positions are expected to be created in 2016, and that rolls back to the baby boomer generation growing older and living longer. Then we need more nurses to fill those holes.
Okay. Nurse practitioner and health promotion. Of course, a nurse practitioner is a very big asset to any GI office, but as far as health promotion is concerned, signs and symptoms of any kind of gastrointestinal disease is what they would pick up on first, and obviously educate. Self-maintenance strategies like IBD and Crohn's and colitis, those are very, very self-managing diseases, but the nurse practitioner, along with the physician, can play a big role in that department in helping these patients understand and maintain compliance. For example, any anti-TNF therapy, which is very time-consuming for the patient at home and in the office to have better results. Because if they do not comply, the nurse practitioner can convey with the long-term use of, or long-term ulcerative colitis, then the higher risk of colon cancer. They also need to teach risks, benefits, and alternatives to any kind of GI medications or even therapies or modalities. Ensuring patients undergo appropriate screening tests such as colonoscopies and upper endoscopies, and screenings for colon cancer and preventative medicine in that way for health promotion. Upper endoscopies for gastric reflux, long-term benefits to that is has a high risk of Barrett's esophagus if they don't have any kind of medication therapy on board, and they can help benefit patients comply again with their treatment and be an advocate to improve patient care and outcomes. Quality of care. This is important because to every patient they expect to see a physician when they come into the office. So the most important thing with quality of care is actually to get the approval of the patient first. Always ask the patient when they come in the office if they mind seeing the nurse practitioner. Some are agree to it, some do not. But once they meet the nurse practitioner and they establish that connection and that communication with them, usually goes over pretty well. However, the doctor should always see the patient first, maybe for a first kind of consult with them to get warmed up to meeting people in the office and the physician. And then once the patient is familiar with the nurse practitioner, they can alternate between the physician and the nurse practitioner. That would be good care for the patient. So then they know that they're getting the full range of care. A nursing assessment on the quality of care will provide vital information. Nurse practitioner needs to understand about specific fears, concerns of the patient prior to and during potentially unpleasant and often undignified investigations or treatments. Some patients will feel that they're with colonoscopies and stuff, or even kind of some GI symptoms, they don't tend to open up as well to a nurse practitioner as they would a physician. So nurse practitioner has to be warm and sensitive to their needs, and it also help increase patient satisfaction. The nurse practitioner is a GI nurse practitioner is a supportive link between patients and doctors, with being consistent, being able to listen, making eye contact, being sensitive to the patient, excellent interpersonal skills, and reduced wait times for the patient as well. A lot of patients really like that. So if the doctor is extremely busy and the nurse practitioner can get them in immediately, there is absolutely no wait time zone. That's very, very important for the patient. In turn, with all the quality of care and health promotion, that helps reduce hospital readiness or even emergency room visits and multiple treatments for the patient as well. The conclusion for a nurse practitioner, obviously it's a good choice for any office to have an advanced nurse in their office. It increases provider adherence to clinical guidelines. It's similar to improved health outcomes, increased patient satisfaction, equal or lower cost, shorter waiting times, and more informed public, and increased accessibility to care. And also it's great support to the staff for any kind of information or go-to.